Hey there, grade 10! A pleasant day, learners! How are you today? I hope you're still excited for today's lesson. Are you? I'm Teacher Dancy Andres, but you can call me Sir Red for short. Welcome to my YouTube channel. I hope everyone is watching today for another exciting episode of learning. May I hear a virtual clap if you are ready? Last episode, we learned the different criteria in evaluating spoken text. Let's refresh your minds by having a first quick review. Remember, a spoken text refers to oral stories, interviews, and dialogues. Anything that requires speaking is considered as spoken text. Examples are speeches, presentation in class, conversations, discussions, role play, and the like. How about the different criteria in evaluating oral text? Nice! We have fluency, which refers to the continuity, smoothness, rate, and effort which language is also spoken. Example is when a teacher is giving her lesson. How about tone? Tone describes your voice pitch or the speaker's attitude. Eulogy is an example of it. Next criteria is cohesion. Refers to the manner of connecting the ideas to make logical presentation of the topic or subject. Giving direction is an example of cohesion. What's the last one? Correctness is when the message is provided by concrete example and supported by facts and real-life situations and experiences. When a priest or a minister is giving his or her sermon is an example of it. Very well, students! You did great in our past lesson. Last episode, you were able to evaluate a video about the final 3 Miss Universe 2018 in their question and answer portion. You were asked to create a 3-minute video based on their answers using the different criteria we had discussed. I also instructed you to post your videos on Facebook and have your classmates be tagged. Were you able to do that?
Aye,
wow!
Captain!
You all accomplished the activity. You're doing great. Before we go further, I want you to listen to this video article about COVID-19 vaccine. Will this article solve our problem about the pandemic? Watch and listen carefully because I will be asking you some questions to answer afterwards. Don't forget to take some notes for some important points as you listen. Okay? If you're ready, say, bring it on!
As COVID-19 cases spike in some countries, it's clear that the pandemic isn't slowing down. That's why many are pinning their hopes on a vaccine.
We're pretty cautiously optimistic that at the end of the year, beginning of this coming 2021, we will have one and maybe more, I hope more than one vaccine that would be available.
Thousands of scientists are now working on more than 150 vaccines, but none is approved for use. So just how close are we to getting an effective coronavirus vaccine?
That's the big question. Welcome to your COVID-19 special on DW News. I'm Monica Jones in Berlin. Good to have you with us. The fight against the pandemic is gaining momentum. The US Food and Drug Administration has granted fast-track designation to COVID-19 vaccine candidates under development by Pfizer and its German partner BioNTech. Now, this is an important step towards getting approval for a vaccine the world is desperately waiting for.
Things are moving quickly at BioNTech. The company's search for a vaccine began in January. By April, it had already begun clinical trials, research at record speed. Production has also been racing ahead. The European Investment Bank has pledged a €100 million loan if the human trials are successful. BioNTech and pharma companies all over Europe are gearing up for mass production of a potential vaccine, even if success remains uncertain. We're already equipping our facilities and finding production partners all over the world to help us produce large quantities. As soon as our production process is up and running, we'll also start producing and stocking it, despite the economic risk of having to throw away all this vaccine if it doesn't succeed in trials. An impressive number of projects, including SARS-CoV-2 vaccine trials, are underway at universities and companies in Germany, Switzerland, and Austria. But research is advancing all over the world. 23 substances are already being tested on humans in projects mainly centered in Europe, the US, and China. All told, scientists are now investigating more than 150 different vaccine candidates. This is necessary because it's quite clear that no single manufacturer could really meet the world's vaccine needs. Global demand can only be met if several companies are producing in parallel, each with their own facilities and with their partners. BioNTech says it could have a vaccine as early as December.
Now, for more, I'm joined by Professor Klaus Zichotek, president of the Paul-Ehrlich Institute. That's the German Federal Institute for Vaccines and Biomedicines. Good to have you with us. So we just heard here at the end of the report, a vaccine by December this year. How optimistic are you that this will work out?
I think generally I'm very optimistic that we will have vaccine products that will be filed for marketing authorization in the US and Europe. In general, for example, the company BioNTech has provided us with encouraging immunogenicity data on a couple of dosages they used from a phase 1/2 trial, and also on the tolerability of these dosages, which is very important. They have also found out that one of the larger doses is not so well tolerated. And I think the next step will be to start now phase 3 efficacy trials and also getting some more information on the vaccine safety in Brazil, US, and Germany. And then there is a very good possibility, if these data come out positive, that filing, at least for marketing authorization, could occur. And we, as the European Medicines Agency, have already indicated that a rolling review would be possible, which means that once the data come in, they can be submitted for review by the regulators one after the other.
All right. Of course, when we talk about thousands of scientists currently working on developing a vaccine against SARS-CoV-2, we also talk about a huge variety of approaches. BioNTech is working on a so-called nucleic acid vaccine that's based on genetic instructions. Let's just take a quick look at how this works.
To develop an mRNA vaccine, scientists have to access SARS-CoV-2's genetic code. They can then synthesize messenger RNA, molecules that carry information from the virus, like how to build specific proteins. The synthetic mRNA is enclosed in a lipid nanoparticle, which delivers the vaccine to our cells. Once inside, cellular machinery follows the mRNA instructions and begins producing the viral protein, which is then displayed on the surface of the cell. That stimulates a protective response from the immune system.
Now, Professor Klaus Zichotek from the Paul-Ehrlich Institute, please tell me what makes an mRNA vaccine a good candidate in the fight against SARS-CoV-2?
Well, first of all, we have to say that we regulators are open to any kind of vaccine platforms that are currently developed as candidate vaccines against COVID-19. What makes RNA vaccines attractive is the technological progress that has been made during the last years. And although we don't have a licensed human preventive vaccine yet, we know from studies, at least in the preclinical or in a clinical trial phase, also on tumor vaccines, that they are generally immunogenic. The next point, of course, is that they use genetic information, and so the steps that are usually used for vaccine development, which are isolating the virus, getting the genetic information, adapting the virus to cell culture, and bringing it up in high amounts in cell culture, can be omitted with an RNA vaccine. So we are left with a lower biosafety limit. And the other plus is, of course, that companies have announced that they can produce millions and millions of vaccine doses up to the formulation within
And
6 weeks or so.
That's what
which
we
would
need,
really
of
be a
course.
plus.
That's what we need, of course. But people also have to be willing to be vaccinated. And as you know, there is a lot of resistance to anything that's genetically modified, from crops to drugs. How justified are these concerns, especially when it comes to mRNA vaccines?
Well, first of all, I don't think these prejudices still exist when it comes to the application of genetic information and gene technology in humans and in medicine, because it has been shown that this is a very effective and very safe technology. Number two, with RNA vaccines, we don't have the issue of any incorporation of sequences into the genome of cells, or be it the germline. Nothing like that can happen, because RNA is a rather fragile molecule. And third of all, with all the different vaccines, no matter whether we know the platforms already in detail or not, they are always treated as one unique new thing that we need all the data about to really understand their safety and efficacy. So the end is that the regulators have to come on the basis of data to a benefit-risk evaluation, and that has to be right. And with preventive vaccines, we really need a large plus to the benefits compared to any risks that we may take into account.
So it's safety first. That's good to know. Professor Zichutek from Germany's Federal Institute for Vaccines and Biomedicines, thank you so much for your time.
It was a pleasure. Thank you.
Well, next up is Derek Williams. He, of course, is our science correspondent, and he's been hard at work answering your questions about COVID-19. Here's our latest installment.
Does remdesivir work against COVID-19, and how?
Remdesivir is an antiviral medication that was originally developed to fight Ebola that has been repurposed in the fight against COVID-19, which is why it's come so far, so fast in trials. Usually that whole process takes much, much longer. In the meantime, because it proved safe during testing in the last Ebola epidemic, it's been approved for emergency use in many countries for COVID-19. As the pandemic continues to rage, supplies of remdesivir worldwide are running short, even though a final regulatory approval in most countries hasn't come yet. The drug works by interfering with viral replication inside the cell. It kind of throws this monkey wrench into the viral reproduction process. Studies have shown that it can shorten hospital stays for severely ill COVID-19 patients. The company that produces the drug now says that its observational data shows that remdesivir also reduces mortality, but that still hasn't been confirmed by clinical trials.
Is COVID-19 latent like herpes?
A number of viruses, not just the ones that cause herpes, can go dormant in the body and then reactivate at a later point in life. Chickenpox, for example, does it too. Even if you had chickenpox as a child, the virus that causes it can remain dormant in your nerve cells and manifest even decades later as a skin condition called shingles. So after an initial infection, could SARS-CoV-2 also go into hiding in your body? Although it's true that many patients struggle for months with symptoms of a COVID-19 infection, that isn't real dormancy in the way we usually mean it. Generally, the viruses that are able to lay low in the body for decades are DNA viruses, like those that cause chickenpox or herpes, or they're RNA retroviruses, like the one that causes HIV. And coronaviruses don't fall into either one of those categories. So although nothing has been ruled out completely, we've never observed latency in coronaviruses, and we don't expect it from SARS-CoV-2.
Did you understand? Are you ready to answer my questions? Alright, let's bring it. Number 1. Is YouTube a reliable source of information? Okay, yes it is. Number 2. Is the news article a scholarly source? Good! Yes! Why do you think so? Or why do you say so? Alright! Because we did hear many experts from all over the world trying their best to produce a vaccine. Number 3. Is it an educational article? Precisely, it provides information for the people. Number 4. Does the article provide reliable, accurate information? Nice one! Based on the article, the different sources were provided to make it reliable and accurate to everyone. Number 5. Is it timely? Right! It goes with the situation that the world is facing now. Number 6. Does the article raise awareness of important social or community issue? Yes! Based on the present situation, we are all aware and worried on when to have the vaccine to protect us against COVID-19. Okay, I think everyone is now ready for our next lesson. This morning, we will discuss about evaluating listening text in terms of accuracy, validity, adequacy, and relevance. But first, let's talk about why evaluate. Nice answer! Once you have found information that matches the topic and requirements of your article or research, you should analyze or evaluate these information sources. Evaluating information encourages you to think critically about reliability, validity, accuracy, authority, timeliness, point of view, or bias of information sources. Just because a book, article, or website matches your sources criteria and that seems at face value to be relevant to your research does not mean that it is necessarily a reliable source of information. It is important to remember that sources of information have already been evaluated for inclusion among many resources. When listening to news reports or speeches, it is important to use critical listening for one not to be gullible or easily fooled by what a speaker says. News reports can be biased or may contain false information. Speeches, on the other hand, can be persuasive, hence, there is a need to evaluate authentic listening texts like news reports and speeches. Let's take this example for you to understand this lesson. A while ago, you reacted to an article you have watched about COVID-19 vaccine. Let's try to evaluate it. These are the following articles and guide questions to consider to evaluate the article you had watched. First, accuracy. How accurate is the information provided by the news article? Yes, it is accurate because this provides us the target number of vaccines to be produced, which is 150,000 different vaccines and thousands of scientists who is studying and discovering to come up with the vaccine against coronavirus. Next is validity. Do the facts presented support the conclusion? Good! Several facts were being presented and studied and were being supported by showing different processes and experiments to measure its validity. Does the article provide us the adequate information about vaccine? Right! Since the scientists undergo several processes and studies, this means they will be able to come up with the adequate number of vaccine needed by the people. How about its relevance? Does the article contain unsubstantiated generalization? Correct! The article was able to show and provide proof and competent evidence to bring our protection against the virus. So, did you understand the things to consider in evaluating context or evaluating listening text, class?
Aye, aye, Captain!
Good! Kindly enumerate. We have the following: accuracy, validity, adequacy, and relevance. Good job, students! Let us proceed to the next part of our lessons. This time, let's determine whether you really understood the lesson by answering this activity entitled Covido-bido. I repeat, it's Covido-bido. Did you get it?
Aye, aye, Captain!
Here, you will still answer some questions based on the article you have watched a while ago. Are you ready? You may refer to your notebook about the things to consider in evaluating we discussed earlier. Are you all set?
Aye, aye, Captain!
That's good. Let's start. Number 1. What is the news report about? It's about the latest updates on COVID-19 vaccine development. Number 2. What is the source of the news? The answer is, the news came from DW News, a global English language news, one of the trusted information and media provider. Number 3. Will you consider the news accurate and reliable? Why? Answer: it's accurate and reliable because all the sources and reference were provided. Gotcha! Number 4. Does the news report have all the necessary details needed for you to be well informed? What's your answer? Yes! Number 5. How important is the news in our life? What do you think is the answer? It's to keep us updated about what is happening every day. Number 6. Why is it important to maintain credibility and reliability in news reporting? What's your answer? Because in an article or any sources of information, the number 1 obligation of the author is to be honest. In order to increase credibility and therefore increase readers and listeners to read, listen and believe of their articles, they should be biased, accurate, trustworthy, and reliable. Did you all get correct answers? Good job, grade 10s! With that, may we give ourselves a round of virtual applause? Very good! Was it easy to evaluate? Or was it difficult? Really? But still, you did an excellent job, students! We have the following: accuracy, validity, adequacy, and relevance. Again, accuracy, validity, adequacy, and relevance. Perfect! Our last activity for this morning is called Speak Up. You need to watch, evaluate, and react on the latest speech of President Rodrigo R. Duterte about the status of the Philippines on COVID-19. You may utilize social media, radio, and television about as your sources. Be sure to use the different points to remember in evaluating listening text. You have to write your answers in your notebook. Please feel free to ask assistance from your parents and relatives. Next meeting, your outputs shall be critiqued by your teachers. You've accomplished much today, students. I do hope that you will be able to apply what you have learned. Congratulations for that! And that ends our morning interaction in English 10. Only here in my YouTube channel. I hope that you've learned a lot today. I'm Teacher Rency Andres, but you can call me Sir Red for short, saying thank you and God bless everyone. Keep safe. Goodbye.